The reason why we actually encourage people with diabetes to quit smoking is that people with diabetes have a major risk of passing away from heart attack and stroke. And so smoking, for example, is a risk factor for that. And so that's one reason why we encourage them to quit smoking. The other is that a lot of people who have diabetes eventually suffer from what we call peripheral neuropathy. So that's nerve damage caused by diabetes. And so what happens is someone with diabetes, their blood is a bit thicker than someone without diabetes when they have high blood sugars. If you look at this tube versus this tube, this one actually shows somebody who has high blood sugar. This one is somebody who has regular, normal blood sugars. If you watch the rate at which the blood is transported, the one with high sugars is much slower. Someone with normal blood sugars, however, they have the proper flow of blood and therefore oxygen to their feet. Now, if you smoke, the areas on your red blood cell where the oxygen is meant to bind to bring the oxygen to your nerves is actually replaced with carbon monoxide. And therefore, when you actually are expecting your nerves at your feet to get oxygen and survive, they are not. They are getting carbon monoxide. You start to feel sharp shooting pain in your feet. They start to feel like pins and needles. They go numb. And then eventually it ends up in your hands. You can't use your hands the same way. This is why quitting smoking is beneficial for people with diabetes.